As we celebrate the 70th anniversary of the University Department of Orthopaedic Surgery, we are reminded of our humble beginnings and the progress that we have made. The department was birthed on the 1st of April 1952. The earliest leaders were Professors John Cameron, Anders Carlin, and Donald Gunn. And it was the vision of these pioneers that spearheaded the development of orthopedic clinical care and education in Singapore. Marking history in 1967, Dr. V.K. Pillay became the first local trainee to head the university department, followed successively by Professors Pesi Chacha and Kamal Bose, placed an emphasis on research with the setting up of research laboratories. Between 1985 and 1988, the department under Professor Kamal Bose moved to the newly completed National University Hospital. Professor Robert Foh went on to set up the Department of Hand Surgery, while Professor Lieng Hin established many academic research programs under the successive leadership of Professors Lieng Hin, Satku, Wang Hee Kit, and Wilson Wang. The values that define this department have been refined and passed on to a fresh and enthusiastic generation currently led by Professor James Wee.
Our strong foundation has allowed this department to push boundaries and reach new heights. Today, we are a department on par with the best centres in the world, keeping ourselves at the frontiers of orthopaedic practice. Our surgeons regularly incorporate advanced 3D modelling to plan complex surgeries. Access to state-of-the-art imaging tools, such as the O-arm, allows safer and more accurate pelvic and spine surgery. Our ever-increasing expertise in MIS and robotic surgery better enables us to improve outcomes in replacement and sports surgery. Coupled with this, our award-winning work at the NUS Tissue Engineering Lab is a prime example where our own cutting-edge research has translated into therapeutic services for our patients. Just as we have done in the past, we will strive to better develop more innovative orthopedic treatments so we can optimize the care of our patients.
One of our department's philosophies is to achieve excellence in research that parallels good clinical work and that advances healthcare. We pride ourselves on our practice-changing scientific work that to this day remains highly cited and adopted around the world. Many of these have become landmark papers of the era. As we uphold this rich legacy, we continue to support our staff and inspire many young researchers to continue in the footsteps of their mentors.
Educating and training the next generation of orthopedic surgeons is a core part of the NUHS mission. The NUHS residency program started in 2010 under Prof. Joseph Tambaya. Under him and his successor, Dr. Gavin O'Neill, our program has successfully trained 5 batches of surgeons who have gone on to make their mark in orthopedics in Singapore. Residents spend their first year doing emergency medicine, general surgery, and anesthesia. This provides foundational skills in surgery and critical care. Over the next 5 years, they gain experience through clinics, operating theatres, and calls under the guidance of our faculty.
The days do fly by very quickly because we have to juggle many different duties on top of our studies. But this breadth of exposure equips us to be well-rounded surgeons, and the experience has been very enriching for me.
We started preparing for our examinations about 9 months ago while doing our usual workload. It was certainly not easy. It was a challenge balancing residency as well as our family as well as personal commitments. Luckily, over here, we have each other's backs. We're like a family. We support one another throughout, and I'm actually so thankful for our mentors as well as our fellow residents for riding through this journey with us.
We could not have achieved so much over the last 70 years without exceptional teamwork. The dedication of our wonderful nurses and the commitment of our superb admin team are all at the heart of our success. As we continue onward, I'm confident that this team spirit will take us to new heights in our quest towards excellence in clinical care, education, and research. It was the people that made all the difference, and they will continue to be the soul of the department. Thank you for the past 70 years, and let us strive for another 70 and more.